Okay, welcome back to the Auditory Learner. This is going to be the study material for um, DH304, Dental Health Education. This is going to be the first recording. We're going to go into the introduction of public health, and then also we're going to discuss the behavior change theories, interpersonal, intrapersonal community, um, and then we're going to go over some quizzes. All right, so let's start from the top. Okay. Um, so we're going to describe um, like the core functions of public health. We're going to define what is health and what is oral health. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. There are many evolving definitions for health. One of them from WHO is a state of being from chronic mouth and facial pain and oral throat cancer, oral infection, source periodontal gum disease, tooth loss, and other diseases and disorders that limit an individual's uh, capacity in biting, chewing, speaking. Okay, so this is the definition of oral health from the WHO. So the one that we're going to remember is the FDI's definition of oral health, because she made it very clear that this is going to be on the quiz. This is the definition here. So it is oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. So that's the definition of oral health that we need to remember. Again, oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with the confidence and without pain, discomfort, and disease of the cranial facial complex. Um, Also, poverty and a diseased state is the opposite of health, and that's also pain and sadness. Okay. Um, Now, according to the CDC, what is public health? Public health is the science of protecting and improving the health of families and communities by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. According to the American Association of Public Health Dentistry, what is dental public health? Dental public health is the science and art of preventing and controlling dental disease and promoting dental health through organized community efforts. So there is an American Association of Public Health Dentistry describing what is dental public health. It is the science and art of preventing and controlling dental disease and promoting dental health through organized community efforts. um, so, dental public health and community oral health is about the same because it shares the same efforts organized by society to protect, promote, and restore health. The form of a dental practice serves a community as the patient rather than individual, which is which what is community oral health concerned with: dental education of the public, applied research, administration of group dental care programs, and prevention and control of diseases on community basis. Um, so mainly, we're trying to see what our approach is to get the desired outcome. Um, and so we need to focus on an implicit goal of improving health outcomes in a population. The field of population health includes health outcomes and patterns of health determinants and policies and interventions, and requires a collaboration of community partners to improve outcomes and an epidemiological approach. So how does it become a health problem? So we need to understand what the criteria is to identify public health problems. A side note here is that a burden is the prevalence and a risk is the incidence. So there's about 12 things. Going to go over them really quick of when things become a health problem, which means that there is a high prevalence of disease or a condition, or a burden of disease or condition, prevalence of a risk factor for the disease, ability of affecting the population as a whole, seriousness of the problem, economic, public health concern, availability of resources, availability of current interventions, cultural appropriateness of the problem, degree to which it negatively affects health equity. Again, health equity is a big thing. What are the 10 most important public health problems? That's going to be alcohol related, food safety, healthcare associated infections, heart disease and stroke, human HIV, motor vehicle injuries, nutrition, physical activity and obesity, prescription drug overdose, teen pregnancy, and tobacco use, as well as dental caries and homelessness. Here's a quiz question. Each of the following is one of the guiding principles, common criteria used to identify public health problems, except one. Which one is the exception? So the answer is minimal cost to treat the problem. So apparently, the following are guideline principles, common criteria to identify a public health burden of disease, degree to which it negatively affects the health equity, political will to address the issue, but the minimal cost to treat the problem is not a guiding principle when it comes to identifying public health problems. So there is a private practice and a public health practice component in relationship to public health services. So in the private practice, you have patient examination, diagnosis, treatment planning, treatment, they pay a fee, then there's a patient evaluation. Patient examination, diagnosis, treatment planning, treatment, they pay, then we evaluate. That's for the private practice. For public health practices, it's different. It's community, it's assessment, surveys, analysis, program planning, program implementation, program funding, and then program evaluation. So these are the counterparts to what I just said for the private. So again, public health is community, survey assessment, analysis, program planning, program implementation, program funding, program evaluation. So we're just gonna put together what goes with what. So I'm gonna put the private and the public health next to each other. So just like in private, we have patient, in public it's community. Then it's examination in private, then in public it's survey assessment. Then it's diagnosis, then it's analysis. Then it's treatment planning, then it's program planning. Then it's treatment, then it's program implementation. Then there's the fee and the payment, then there's program funding. And then at the end, it's patient evaluation and then program evaluation. Sounds pretty straightforward. So again, which of the following components of public health of a public health plan correlate to those in private practice settings? So we should know this. So the answer is survey, analysis, implementation, and funding. Survey, analysis, implementation, funding. So the question was, which of the following components of public health of a public health plan correlate to those in private practice? So we're looking for the ones that are in the public health, not the private. So when we see the other answers, for example, survey, diagnosis, implementation, and then patient evaluation, we know that's wrong because that is everything public health, but then the last one is patient. So that's wrong. Then the other one is wrong because it's diagnosis, program planning, implementation, and fee payment. So that's like mixing public health and private again. Then again, it's examination, analysis, treatment planning, appraisal. That's wrong. So we're looking just strictly for public health components here. That's survey, analysis, implementation, and funding. So, who funds public oral health solutions such as immunization, tobacco cessation, fluoridation, control of exposure, and seatbelts and all that stuff? Is the Department of Health and Human Services. There are many organizations or agencies that fall under the Department of Health and Human Services. Um, there's a lot of them, actually. And I'm just going to read all of them off here, but the first four seem to be the main branches. These are the Administration for Community Living, ACL, Administration for Children and Families, ACF, Centers for Medicare and Medicaid Services, CMS. Then there is the Public Health Service, which is PHS. Now, the rest that I'm going to announce fall under the Public Health Service. So the previous three, the ACL, ACF, and CMS, are on their own. But under the Public Health Service, the PHS, we have the Agency for Healthcare Research and Quality, AHRQ. We have the CDC, Center for Disease Control and Prevention. We have the Agency for Toxic Substances and Disease Registry, ATSDR. We have the Food and Drug Administration, the FDA. This is the big one. We have the IHS, the Indian Health Service. We have the NIH, the National Institute of Health, and also the NIDCR, which is the National Institute of Dental and Cranial Research. We have the SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And then we have HRSA, which is Health Resource and Service Administration. So the PHS has some pretty big players under there, like the FDA, the CDC, and the NIH. So that was interesting. There are also some guiding principles. There are 7 characteristics to public health solutions. These characteristics to the solutions are going to be that they are not hazardous to the life or function. They are effective in reducing and preventing targeted diseases or conditions. They easily and efficiently implemented. They are easily and efficiently implemented. The potency maintained for a substantial time period. They are attainable regardless of socioeconomic status, effective immediately upon application, and affordable, cost-effective, and within the means of community. So now we're going to discuss the role of government in public health, and the role for them is going to be surveillance, risk factor identification, intervention evaluation, and evaluation after. Okay. Another important thing we need to understand is what are the 3 core functions of oral health, or the 3 core functions of public health agencies at all levels. So this is very important. It's going to be assessment, policy development, and assurance. All this is centered around the concept of equity, okay? When we're talking about assessment, we are looking at assessing and monitoring population health, investigating, diagnosing, and addressing health hazards and root causes. So that's going to include like a systematic collection, an analysis, and sharing information in the health community on the health of the community. Assessment is still comprising of epidemiological data on the health status of community health needs. It also depends on essential intergovernmental and interagency teamwork and reflects the responsibility of each public health agency. So that's going to be assessment. Then we're going to go to policy development, which is going to demonstrate the responsibility of each public health agency to develop comprehensive public health policies, encompasses the use of scientific knowledge in making public health decisions, and requires a strategic approach, and is based on the democratic political process. In addition to that, the policy development is going to be community effectively to inform and educate, communicate effectively to inform and educate. It's going to involve strengthening, supporting, and mobilizing communities. It's going to involve creating, champion, and implementing policies, plans, and laws. And it's also going to incorporate utilizing legal and regulatory actions. So everything there falls under policy development. And the last one is assurance. What is involved with assurance? It's going to be building and maintaining a strong organizational infrastructure for the public health. It's going to involve improve and innovate through evaluation, research, and quality improvement. It's going to involve build a diverse and skilled workforce and also enable equitable access. Again, to add to the assurance portion of this is that assurance is going to entail reassurance of public health agencies that services necessary to achieve the agreed upon goals are provided by one of at least the following means, which is encouraging action by others, private or public sectors, requiring such action through regulation and providing services directly. It involves key agency policymakers and the general public in determining high priority personal and community wide health services and provides subsidization or direct provisions of high priority personal health services. So again, that was like a very detailed of what assessment, policy development, and assurance is, which are the core functions for public health agencies at all levels. Okay. The 10 essential public health services. So according to the CDC, and this encompasses the 3 core public health functions, there are 10 services, okay? And they fall under these core functions. So as the 10 essential public health services, according to the CDC, which we're going to discuss right now, there's 2 for assessment, there is 4 for policy development, and then there's 4 for assurance. Okay, and so let's start with the first 2 for assessment. According to the CDC, the first 2 essential public health services are assess and monitor population health status, factors and influence, and investigate, diagnose, and address health problems and hazards affecting the population. That's for assessment. The next 4 for policy development are communicate effectively to inform and educate, strengthen, support, and mobilize communities, create, champion, and utilize legal regulatory actions designed to improve and protect the public's health. That's policy development. And then assurance is assure an effective system that enables equitable access, build and support a diverse and skilled public health workforce, improve and innovate public health functions, and build and maintain a strong organizational infrastructure. So we kind of just reviewed that. Now, that basically is what was in the cyclone looking circle of what is the core functions. And when I look back, it's 100% true. That's 2 for assessment, 4 for policy development, and 4 for assurance. So that's 10. So there are 10 public health, essential public health services. Again, national oral health initiatives have the common goal of promoting oral health, improving the quality of life, eliminating oral health disparities. The first major national oral health initiative in the United States is the 2000 Surgeon General's report called the Oral Health in America. That was the very first oral health initiative in the US. In the year 2000, Surgeon General's report, he put out the Oral Health in America. The updated 2020 Surgeon General's report on oral health was launched in November 2018. And the document Progress in Oral Health Since 2000 conveys a vision for the future. Okay. One thing is too that we need, one of the premises of public health is to increase life expectancy. At least that's what they tell us. We need to make sure we understand what the Healthy People Initiative is. It's done every 10 years. The U.S. Department of Health and Human Services leverages scientific insights and lessons learned from the past decade, along with new knowledge, current data, and trends. So we have the new Healthy People 2030. Okay. So what we're going to do now is we're going to get into some really quick case studies. Some of these case studies, I'm just going to get into it really quick. I'm going to read the question and then read the answer. Okay, so case study number 1. The staff of a nonprofit health center in your community approach you about helping them develop an oral health program for the population they serve. Based on the experience of their patients and observations of the health providers employed by the health center, their initial interest is dental care for underserved low-income adults and older adults in the community. Here's the question. As your first step, you collect background information on previous successes for solving dental public health problems. Here's the question. All of the following, except one, are examples of dental public health successes that have been documented in relation to improving oral health and oral health care in the US. Which is the exception? So the exception is elimination of oral health disparities. That is the answer because everything else is an example of dental public health successes. So let's look at what are dental public health successes. Those are improved access to oral care, understanding of and emphasis on the link between oral and overall health, and implementation of water fluoridation. Those are all successes. The elimination of oral health disparities is not a success because we haven't removed the elimination of oral health disparities. Pretty straightforward. Case study number 2. Which of the following is the first major national initiative that continues to impact the dental public health practice today and provides a resource for background information on the needs of this priority population? So which of the following is the first major national initiative? So we just talked about that. It's the Surgeon General's report on oral health in America, which came out in the year 2000, which created the link and documented the link between oral and systemic health. Okay, it's not Healthy People 2030 because that's not the first major initiative and it's not anything else. Okay. Case study number 3. Assessment data reveal high rates of untreated oral disease and lack of dental insurance coverage among the population interest, regardless of socioeconomical status. The community considers several solutions to the public health problem of oral health care for this priority population. Based on the characteristics of the ideal public health solution, which of the following dental public health programs is the best public health solution to the problem identified? So the problem is that there are high rates of untreated oral disease and a lack of dental insurance coverages among the population, among this specific population, doesn't matter of socioeconomical status. So a lot of oral disease, a lot of periodontitis, a lot of cavities, a lot of people without insurance. So what is the best solution to that? The answer is going to be a combination of two or more of these and other programs. So that means that it's gonna. So let's look at a free emergency extraction dental clinic to address dental pain, a free mobile denture clinic operated by denturists in long-term care, an educational campaign on the oral health care needs for adults and older adults. A combination of two or more. Okay, so basically all of the above. A combination of two or more of these programs. So when you have a population that doesn't matter socioeconomical status, they're all doing bad, and then you need all hands on deck. So you need to educate and treat. Okay, so a combination of two or more. Okay. Case study number 4. A grant application is submitted to the program to support the program. This is an example of which component of community oral health practice. It's going to be financing. Okay, so whenever there is a grant, you think about money. That's how you get money. It's not program planning, it's not program operation, and it's not analysis. A grant application is for financing. Case study number 5. The community population includes a high rate of retired adults. Thus, the community has a higher rate of long-term care facilities than other communities of comparable size. Review of the state guidelines for long-term care facility reveals inadequate requirements to ensure access to oral health care of the residents. Seeking to change these guidelines would address which core public health function. So if you want to change the state guidelines for long-term care facilities, that's going to be policy development. It's not going to be assessment. It's not going to be assurance. It's not going to be because you want to make a change in the long-term state guidelines. So when you think state guidelines, that's policy. Great. So we just finished that. The next thing I'm going to touch upon here is, before we get into the final quiz questions for this week 1, I want to touch on the behavior models. There are intrapersonal models. It's like within the people, right, themselves. There's interpersonal level models, and then there's community level models or theories. So really quick, for the intrapersonal, we have 2 theories. There's the trans-theoretical model, or the stages of change, which are pre-contemplation, contemplation, preparation, action, maintenance, and they must achieve each step or they relapse. So that's the trans-theoretical model. It's pre-contemplation, contemplation, preparation, action, maintenance. Then there's the health belief model, which is 4 steps. There's perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy. Limitation is attitude or cultural belief, does not assess the living condition or health history. Then there's interpersonal models, which is the social learning or the cognitive theory. This is observational learning, modeling, and they make guesses. So the restrictions are unreliable evidence, like on social media, and the reciprocal determination is a bidirectional behavior of people. So there needs to be a bidirectional behavior of people. That's the social learning cognitive theory. Then there's the motivational interviewing. This one is Professor Patel's favorite. Needs to find motivational component originally made for substance abuse. The first step is accepting with empathy, put yourself in their shoes, roll with the resistance. The second step is create a discrepancy. If something continues, it will get worse, for example. And the fourth step is there must be self-efficacy to maintain the change, which is open-ended questions, be affirmative and not judgmental, reflection and summary, OARS. Open-ended questions, affirmative, reflection, summary. Okay, so those 2 were for interpersonal. Then there's community level theories, which are community organizational theory, which is the grassroots, inside out, and empowerment, community competency, participation, issue selection, critical consciousness. Then there's the diffusion of innovation theory, or the relative advantage, which is like the mask mandates is an example. Some people didn't do it because it takes away autonomy. Spread new ideas, products or sales or services, can be fast or slow. Innovators, early adopters, early majority, late majority, laggards, relative advantage, compatibility, complexity. And again, these examples are like COVID, vaccinations and seatbelts, etc. And then the third theory is going to be the organizational change theory, which is a combination of theories, must adopt and implement and sustain new approach to where the stage strategies are required at each step. Great. So again, I'm just going to kind of review really quick here these health promotion theories. Intrapersonal are stages of change theory, or the trans-theoretical model is the intrapersonal. Health belief model is the intrapersonal. Interpersonal is the social learning theory. Okay. Interpersonal is the social learning theory. Okay. And that also includes the motivational interviewing. All right. Let's just make sure that we're talking about what we need to talk about here. And then the community level is community organization theory, diffusion of innovations, and organizational change. All right. So, again, these theories are abstract notions that come to life only when they are applied. Sometimes theories are called conceptual frameworks or models. They help analyze situations to apply solutions. All right. Um, so it's the behavior that leads to improved oral health that can be affected. Okay, so that's why we're doing this. We need to change people's behavior. Again, intrapersonal, individual, interpersonal between people, and community is including institutional and organizational change. So the interpersonal, this is just a recap again. Interpersonal is the stages of change theory, which is the trans theoretical model. So it's a cycle that occurs over time rather than a single event. All right. It assumes that at any point in time, everyone is at a different stage. So people can cycle through these various stages. Um, it starts by like increasing awareness, right? Initiating behavior and then progressing to maintaining motivation. Then the other interpersonal is the health belief model. This one allows us to assess perceptions of how susceptible one is to a health risk, whether they believe that they are, you know, if they, whether one believes that recommended preventative behaviors will result in less susceptibility. So the primary hypothesis for the health belief model is that the increased perception of severity and susceptibility to a disease results in an increased probability of taking action. Then you have the social learning theory. So people learning primarily by remembering and imitating others, vicariously living off of others, judgments voiced by others. And so this is very involved with the environment. People learn through their own experiences by observing actions of others and the results. So behavior change is accomplished through interaction of personal factors. And then you have the community level, which is the community organization, diffusion of innovation, and organizational change. So the way I'm going to remember this is that the diffusion of innovation one is the one that's the mask and the vaccinations. So this is cool. We did all this. A lot of information on this thing here. So from here, we're going to shift gears now. We're going to discuss and go over the quiz one of people's health. Okay, and we're going to end it right here. So which of the following statements differentiates public health from private practice in dentistry? And the answer is dental public health is the form of dental practice that serves the community as the patient rather than the individual. Okay, so dental public health is the form of dental practice that serves the community as the patient rather than individuals concerned with dental education of the public, with applied dental research, and with the administration of group dental care programs, as well as prevention and control of dental diseases on the community basis. Which of the following terms refers to the effort that is organized by society to protect, promote, and restore the health of quality of life? So which of the following terms refers to the effort that is organized by society to protect and promote and restore the health and quality of life? That's going to be public health. Yeah, so public health, both public health and community health refer to the societal effort. Public health is concerned with prevention, health education, recommending policies, administering services, conducting research, and limiting health disparities by promoting healthcare equity, quality, and accessibility. Community health includes a wide range of healthcare interventions, including health promotion, disease prevention, treatment and management, and administration of care. That was question number 2. Which of the following terms refers to the effort that is organized by society? Yeah, that is public health. It's not social stratification, not class structure, it's not population demographics. Okay, question number 3. Each of the following is one of the guiding principles, common criteria used to identify public health problems, except one. So we talked about this. It is the minimal cost to treat the problem. So everything else is a criteria to identify a public health issue, except the minimal cost. So the guiding principles used to identify a health problem includes the burden of disease of the condition, prevalence of a risk factor of the disease condition, ability of affecting the public population as a whole, seriousness of the problem, economical or social impact, public health concern, political will to address. None of those include the minimal cost to treat the problem. So that's why that is the answer, because it is the exception. Question number 4, which of the following is a public health problem rather than a public health solution? So a public health problem is chronic diseases of the expanding population of older adults. That is a problem. That is not a public health solution, because the rest of the answers are solutions, such as seatbelts, airbags, fluoridations, immunizations. Okay, kind of straightforward there. Which of the following represents one of the characteristics of public health solutions? The answer is they should be effective immediately upon application. So this goes into the 7 characteristics of public health solutions, which are as follows. They're not hazardous to life or function. They are effective in reducing or preventing the targeted diseases or conditions, easily and efficiently implemented, potency maintained for a substantial time period, attainable regardless of socioeconomical status, and effective immediately upon application. So the wrong answers were socioeconomical status, should limit distribution, potency, should be maintained for a short time in the event that problems require retooling, and a long implementation period demonstrates conscientious planning. So those are all wrong. The correct answer to which of the following represents one of the public health solutions characteristics is they should be effective immediately upon application. Question number 6, which of the following dental treatments modalities meets all 7 characteristics of public health solutions needed to be considered an effective treatment for dental decay? So we just talked about the 7 characteristics of public health solutions, all right, just previously. And so, which of the following dental treatment meets all 7 of those? It's community water fluoridation. Community water fluoridation meets all 7 characteristics needed to be considered an effective solution to the problem of dental decay. All right. The wrong answers to that question were glass ionomer restorative material, dental amalgam, stainless steel crowns. So those kind of feel obvious. Number 7, which of the following best describes the prevalence of dental disease as a dental health problem? It's going to be, the answer is universal. So which of the following best describes the prevalence of dental? So it's universal, because dental diseases are universal, chronic problems that do not undergo remission if left untreated. For American children ages 3 to 5 years old, 29.7% have caries. Experience in primary teeth, 14.1% have untreated caries in primary teeth. For American children ages 6 to 9, 51.7% have. Okay, so it's universal. Which public health component is equivalent to diagnosis in private practice? Oh yeah, that's going to be analysis, because you're making an analysis to make the diagnosis. Yes, analysis is equivalent to diagnosis. The survey is equivalent to an examination. The program planning is equivalent to treatment planning, and program evaluation is equivalent to patient evaluation. In addition, the payment and the fees are equivalent to program funding. Number 9, the federal government's role in participating in dental health related activities falls under the jurisdiction of which of the following? That's going to be the Department of Health and Human Services. All the other ones are wrong, all right? Department of Interior, Institute of Medicine, Association of State and Territorial. It's pretty simple. Yes, the federal government's role in participating in dental health could fall under the DHHS. The primary involvement of the federal government in public health is to provide an infrastructure, research, surveillance, and funding for programs that are carried out. So number 10, which of the following organizations publishes Healthy People? Again, this is the Department of Health and Human Services. Healthy People provide science-based goals and measurable objectives for the US. Perfect. The Center for Disease Control and Prevention, CDC, is an operating agency under which of the following? It's the Public Health Service. We just went over that. Okay. Which federal government agency supports research to improve the quality of healthcare and to reduce its cost? That is the Agency for Health Research and Quality, AHRQ. The AHRQ supports research to improve the quality of healthcare, reduce the costs, and address patient safety and medical errors, and increases access to care. The CDC works to protect people's health and safety by addressing a wide range of health threats, including oral diseases, through the Division of Oral Health, and focusing on the prevention of wellness, providing the HRSA is a primary. Okay. So the one that improves quality of health is the Agency for Healthcare Research and Quality. So quality. Number 13, according to the plan, the next version of Healthy People 2020 will be Healthy People to be released in which year? 2030. All right. What 3 core public health functions were identified in an Institute of Medicine report in 1998? They are assessment, policy development, assurance. The core public health functions of assessment, policy development, assurance were identified in IOM report 1988 or 90. I don't know. The report states, because they have 2 different ones. The report states that the core public health functions were developed to protect, promote wellness and quality of life, to prevent disease, injuries, blah, blah, blah. And the last question here, which of the following is a guiding principles, common criteria used to identify public health problems? It is degree to which it negatively affects health equity. So which of the following is a guiding principle, common criteria used to identify public health problems? It is the degree to which it negatively affects equity. The guiding principles, though, are in total: burden of disease or condition, prevalence of risk factors for the disease or condition, ability of affecting the population as a whole, seriousness of the problem, economic or social impact, public health concern, political will to address the issue, availability of resources, requirement for group action to solve the problem, availability of current interventions, cultural appropriateness of the problem, and degree to which it negatively affects equity. That's a guiding principle. The rest of them are wrong because they are if the problem is at the local, state, or federal level, or whether the problem is a disease or a bacterial virus, or if the problem affects people in the home. So that all sounds pretty wrong. The equity in there kind of tells us there. Great. Good job on the brainwash there. Hopefully this helps. Okay, that's video 1 for DH 304, dental health education. Thank you very much.